Welcome to Facial Plastics Friday. It's Dr. Brace here, and we're answering your questions from Instagram. And a great question we got was, what's better, a genioplasty or a chin implant? And so for those of you that don't know, a genioplasty refers to the chin. Plasty in surgery means reshaping, and so a genioplasty is when you actually surgically cut the lower part of the jawbone here and you move it forward to create more chin projection. So a sliding genioplasty is the classic version of that. So what's better? Should you cut the bone and slide it forward and put plates and screws and hold it in place there? Or should you just put an implant in? My answer to that would be, it depends. I love chin implants. I think the right size chin implant and the right candidate really makes a beautiful, or creates a beautiful result on the person's face because it puts the face in harmony. If you have a very small chin and a larger nose, having a bigger chin and a smaller nose would put your face into balance. So somebody with a large nose, we almost always talk about a chin implant if their chin is small in order to achieve that balance. But that depends part comes from, what is your occlusion like, or what is your bite? If you have a very small chin and you have an overbite because your mandible is too small, then rather than doing a sliding genioplasty, it makes sense to see an orthodontic surgeon and actually have your whole jaw moved forward to move your teeth in line so that you can chew properly and eat properly. If that's the case, then I would say a jaw surgery over a chin implant for sure. But if you have a normal but small sized jaw, a normal occlusion, and you just want a little more definition, then I love a chin implant. It can be put through a very tiny 1.5 cm incision underneath the chin. I like going through the skin rather than the mouth because I don't like getting saliva onto the implant, which puts it at risk of infection. So right here, you put a little incision, you slide the implant in, it sits on the bone. It gives you a beautiful projection. It looks natural. You can't really feel the implant once it's healed and once it's in place. It's a very quick procedure. It's very little risk. It's really just a risk of a bruise, some bleeding, and theoretically the implant getting infected if it's not done properly, but it's very safe. The problem with a sliding genioplasty for someone that doesn't need dental restoration is that you're doing a pretty big surgery. You're cutting from the inside of the mouth, you're sawing that jaw, you're using plates and screws to move it forward, you're closing it up. So now you have plates and screws that are exposed to saliva, you have a bone that has to heal properly, you have the risk of infection, the risk of hardware extrusion. To me, the risks don't outweigh the benefits for someone that just needs a simple augmentation of their chin. So I would say go with the implant unless you have a dental issue where you need to realign your teeth, then go with the surgery, but make sure you go and see an orthodontic surgeon that specializes in it, because that's something that you don't want to have done wrong or done incorrectly or done not perfectly. Hope that answers the question. Everybody have a great Facial Plastics Friday and a great weekend.